Today we're going to talk about back pain. In particular, back pain with walking. It's a pretty common problem that comes up, especially after a neurologic injury when you've lost the ability to walk and now you're trying to regain the ability to walk. When you start to get into those longer distances, a lot of times people start to experience back pain. So today we're going to go over what causes the back to get sore or why you feel like you get fatigued faster when you're walking, because a lot of times those two complaints go hand in hand, as well as some strategies to improve your walking distance and your walking speed with less back pain. If you're new to this channel, I'm Tara. I'm a neurologic physical therapist, and on this channel we talk about anything and everything related to mobility, health, fitness, and mindset, with the end goal of empowering you with as many tools as possible to live an overall more active, healthier life. And all that being said, today we are going to talk about back pain. Now, I know I've talked about it before, but there are a lot of new subscribers who might not have gotten this information the first time around, as well as my perspective shifts a little bit with each patient in their specific situation and how we tackle it. So I learn a little bit more about all the nuances involved with low back pain as it relates to relearning how to walk after a neurologic injury. So I thought I would do a fresh video with maybe a little bit of a new perspective. So why might your back hurt when standing for long periods of time or walking? Well, there are a few reasons, but first let's just talk about our body structure, big picture. All of our bones are designed to kind of sit on top of each other. So when we're perfectly straight or vertical, our bones all just kind of stack on top of each other, and there's very little energy expended to keep us in that position. However, any little bend in that structure, whether it's the entire structure or the entire body tilting to one side, or there is a segment, either the knees, the hips, a vertebrae, or a portion of the back or our neck, any one of those components gets a little bit of a bend in it, then our muscles need to do a lot more in order to keep us upright. Why? Because if the structure is vertical, no muscles really required, everything stacks up on top of each other. Any little bend in that structure, now all the muscles on one side of that structure need to work really, really hard in order to prevent us from collapsing. So that's number one. If you have a little bit of a bend in your knees or a little bit of a bend in your hips, or you have a little bit of what we call a forward head or forward shoulder position, now you've created a little bend in that structure, and so the muscles on the back side, the back, need to work a little bit harder in order to prevent us from just folding in half. So over time, that can definitely make the back start to hurt, just because of the fact that they're having to work a lot more than they are designed to work. So they're very small muscles, and now they're having to do the majority of the load and taking the load away from some of the bigger muscles. So again, number one, someplace in the structure there is a bend. Number two is weakness, primarily in the hip muscles. So when we take a step, we have to lift one leg up when all of our weight shifts to one leg. And I've talked about gait a lot on this channel. So hopefully you guys kind of understand the basics about gait and kind of what's going on during each phase of gait. But during the standing phase of gait, meaning all of our weight's on one leg and the opposite leg is stepping forward, our hip muscles, primarily the muscles in the back of the hip and the side of the hip, have to do a lot of work to keep our hips level. So when we're standing, we're on two legs. There are two support beams underneath the structure, which is the hips. We lift one up. Now all that weight shifts to one leg. Those hip muscles are designed to engage and hold our hips level. If you have weakness in those muscles, you will have a tendency to drop. The other hip will have a tendency to drop, which throws your entire upper body to one side. Again, putting a lot of stress on those back muscles. And over time, doing that on every single step can create back pain. The other reason is if you have spasticity. So if you have spasticity in the muscles that point the foot down, so spasticity is an involuntary muscle contraction. A common area to have spasticity is in the muscles that point the foot down. If you have spasticity in the muscles that point the foot down, or even foot drop, let's throw foot drop in this category as well. So if you have involuntary pointing or you have weakness in the muscles that lift the foot up, when you stand on that leg under normal conditions, as we go through stance phase, our ankle is dorsiflexing as it moves our body forward. If you either have weakness in the muscles that lift the foot up, meaning you can't dorsiflex, or you have involuntary pointing of the foot, that keeps your weight back. And in most cases, what people do is they bend forward at the waist to compensate. Again, it goes back to number one. Now you've kind of taken yourself out of that vertical alignment and again putting more stress on the back muscles. So spasticity in the ankle or weakness in the muscles that lift the foot up, foot drop, i.e. foot drop, could also cause back pain over time. And the next one is spasticity in the quadriceps. So under normal conditions, there is a moment. So remember I talked about that standing phase. There is a moment where the knee flexes a little bit or bends, and that helps to kind of displace our center of gravity, our body forward as we go through standing phase on that leg. If you have overactive quadricep muscles, that again will throw your body weight backwards, and in most cases the compensation is to kind of throw your upper body forwards to kind of propel you forward. And again, that is a bend in your hips when it shouldn't be bent, putting more stress on the back muscles and causing pain. And the last one, which kind of goes along with that hip weakness, is spasticity in the muscles that bring the legs together, or the adductors. Very, very common. When the knee extends, those adductors kick in, meaning it brings your legs together. If your foot is on the ground and those adductors kick in, what's going to happen is your other hip's going to drop, or you're going to get like that, what we call that model walk, where your hip's going to go out to the side, again, putting unnecessary stress on those low back muscles. So those are all the reasons why you might have low back pain when you are walking. So depending on what the cause is, that would determine how you treat this condition or ways to minimize that low back pain when you're walking in order to walk longer distances. So first, let's just talk about devices, because I talk about this stuff a lot, and it's because it's so important and it's worth it to repeat it as often as I can work it into a video. If you have an AFO and it's articulated, meaning the ankle joint bends, and you're not wearing it, in most cases you were given that AFO because you have either spasticity in the ankle or foot drop, or you started out with foot drop and now you have spasticity, but there was something going on in your ankle as to why the doctor ordered an AFO. So you need to wear that AFO. If your AFO is solid and you're wearing it and you're getting back pain, it's because that solid AFO is keeping your body weight backwards, and you need to go back to your orthotist and see if they can articulate it, or check with them to see if you're ready to have that brace articulated. In most cases, you're given an AFO early on and they keep it solid because you need that extra stability in the early stages, and then no one ever follows up, or the ball gets dropped somewhere and they never articulate that brace. So if you have a little bump on the outside of your AFO, if the plastic isn't real smooth and runs all the way down the side and you see this kind of little bump out to the side, that usually means that your brace is pre-articulated, meaning that at some point the person that made it knew that you were going to need it articulated at some point, so they already went ahead and kind of prepared the AFO to be articulated. So that'd be another sign that I would go back into the orthotist and try and get that brace articulated. So number one treatment is, if you have an AFO and you're not wearing it and you want to start walking longer distances, definitely wear that AFO. At least wear that AFO for those longer distances. I know a lot of people want to get out of them and they think they're annoying, and completely understandable, but maybe you just pull it out of the closet on those times when you want to walk those longer distances. Number 2 is an assistive device. So if you've gotten really good and you've worked yourself off of the cane, there is a chance that maybe your hip wasn't prepared to be off of the cane yet, so your hip isn't really that strong. And so what happens is you are getting what we call that Trendelenburg Gate. So those hip muscles aren't kicking in when you pick the other leg up, and so that hip is dropping, and that's causing the back pain. Again, my suggestion would be pull that cane out. Even if you don't want to use it all the time, at least maybe use it when you're walking those longer distances. Now, if you have a knee that goes into hyperextension, I've talked about this before as well. There's something called a Swedish knee cage. And what that does is it kind of forces your knee into flexion. So what it'll do is if your knee is popping back and it's keeping your center of mass behind your heels and you're having to lurch forward, what that Swedish knee cage does is it puts a little bend in your knee, helping you to kind of move that center of gravity where it needs to be, which is directly over the middle of your foot, kind of over the shoelaces if you were to draw a line straight down through your body. So a Swedish knee cage is very effective. I will put a link where you can purchase one on Amazon in the description below. So those would kind of be all of the devices that you would want to check off your list, and make sure you're using the appropriate device for the given time. So what I mean by that is there's some cases where you don't have a lot of spasticity, meaning in your home when you're in a controlled environment, but if you go out into a more uncontrolled environment or a more stressful environment, your spasticity is stronger. And so maybe it's in those situations that you pull that assistive device out, or that you put that AFO on, or that Swedish knee cage on. So just something to consider. It doesn't have to be black or white. It's not all or none with devices, but it's using the right device at the right time to improve your quality of life so that you can enjoy moving around, spending time with family and friends, and not having back pain. So now let's just talk about stretching for a minute. So if you have a foot that's pointed and it's been pointed for a while, you most likely are just always positioned a little bit behind your heels because that foot is pointing. And if that is the case, you need to stretch that ankle every single day. Yes, every single day for at least 2 minutes, 7 days a week. 2 minutes. Not that long, but it really is not going to be effective unless you're doing it every single day. So just have a wedge in the corner of your bedroom, and just every morning spend 1 to 2 minutes just standing on that wedge, stretching your ankle into dorsiflexion. You can already see that position of the ankle helps to bring that body position forward. So stretch, stretch, stretch. If you're someone where your knee locks out every time you stand on it, my suggestion is to do a little bit of crouch walking every day. I talk about crouch walking a lot on this channel. The reason it's effective is because you're learning how to kind of support your body weight on your leg without letting that knee lock out. So the closer you get to a straight leg, the more likely that knee is to lock out. So crouch walking is just one way, just keeping your knees bent throughout the entire gait cycle or walking cycle, relearning how to support your body weight on an extended leg, but not a locked out leg. So crouch walking. If you are having back pain, I highly recommend the method that I show most, which is with your hands behind your back to take the stress off your back. But the key is that you want to keep your upper body upright. And again, if you're having back pain, this could make back pain worse as well. So you don't want to do it for long periods of time, but occasionally just to kind of relearn or retrain your body how to stand on an extended leg, but not a hyperextended leg. If you have that spasticity in the adductors where the legs are pulling in together, my favorite activity is kind of like a lateral toe tap. So the working leg, or the leg that's spastic or pulling inward, is on the ground, and then you just do a lateral toe tap onto a kind of high step with your opposite leg, kind of learning how to support your body weight on that leg and abducting at the same time without that leg pulling in or without that opposite hip dropping. And then along those same lines, You also would want to maybe try and incorporate some hip abduction work. So to strengthen those muscles that extend the hip and move that leg out to the side. Remember I said that's one reason why you might have back pain, is that the muscles aren't strong enough, those hip muscles aren't strong enough to hold your hips level when you pick your other leg up. You would want to strengthen those abductors. So for just true hip abduction strengthening, the easiest exercise to do is just to stand and just move your leg out to the side. So this is by far the easiest way to isolate those hip abductors. Once you can do that hip abduction standing, next you would want to go to laying down. It's using a little bit more gravity, so it does make it a little bit harder. The key to this exercise is to make sure your body stays really, really straight. So a lot of times what people do is they try and use their hip flexors. So they rotate their hip kind of outward a little bit and lift it, and then that's not really isolating that hip on the muscle on the outside of the hip. So one option or variation that you can do is to do it against a wall. The wall will kind of serve as a marker to kind of keep your hips straight. So a lot of times what people do is they rotate upwards and bring the leg up. But instead, when you do it against the wall, you can put something behind your heel and just slide that leg up the hill. Slide that leg up the wall, that heel up the wall. That is a better way to kind of ensure that you keep your hips straight and you're not rotating and compensating with your hip flexors. Now, in addition to moving the leg out to the side, you also want to work on just lifting that hip up. That's also working those hip abductors. So you want to stand with the working leg up on a step, let this leg drop down. Ideally, eventually you want to be able to do it without holding on to anything, because whether you are focusing on not using the arm or not, most likely you are going to use your arm a little bit. And then what you're doing is you're basically just trying to raise this opposite hip up above this hip, and then let it slowly go back down, and then back up, and then back down. And again, that's working that true hip abduction and stopping that hip from dropping out to the side. So for this exercise, what we're working on is true hip abduction. The leg that we're working is the leg that's pushing into the ground and away. So this is the working leg. We're walking in that direction. We have a resistance band pulling us that way. So we're fighting that resistance band. And when we push this leg down and into the floor, that's when we're really working those hip abductors. And you want to work this moving out, because that's working what we call like concentric control. And then you also want to work it going back. It's working what we call eccentric control, or slowing your body down. So you do want to work it in both directions. And again, you're pushing that foot into the ground and then pushing away. And again, that's working your hip abductors. And then when you come back, you're trying to slow that movement down. And so those would be all of the exercises that I would do. Now there's one other thing I want to talk about, and that is just to help you have a good dialogue with your doctor and really come to a decision that's the best decision for you when your doctor is giving you options on ways that he might be able to help you. So it's very common that someone after a stroke will start to have back pain, and they'll go to a doctor, and the first thing the doctor will do is take x-rays, and 9 times out of 10, the x-ray will show that you have some stenosis or you have some degeneration in your spine. They may even say you have some little bone spurs in your spine. And now I want to be very clear. I am not a medical doctor, so I'm not diagnosing you, or I'm not saying that I know what's best for you. I'm just giving you more information so that you can be informed and work with your doctor to make the best decision for you. And there's some evidence that suggests that all adult humans over the age of 25 or 30 start to have little bits of kind of joint degeneration in the back. Some even have herniated discs that are asymptomatic. So the reason I say that is if a doctor says you have this herniated disc or you have stenosis and you did not have any pain in your back before your stroke, I would receive that information kind of with a grain of salt from your doctor, because maybe the stenosis is causing your back pain, but most likely that stenosis was there before your stroke and you didn't have back pain before your stroke. So in that case, I would say it probably goes back to one of those things I said at the beginning of the video, and maybe not necessarily that stenosis that showed up on that x-ray. And then in addition to that, and again, I'm not a medical doctor, but if your doctor is recommending a cortisone injection and he does not watch you walk or ask about your movement or look at your posture at all while walking, I would say that I would maybe get a second opinion, because that doctor does not have all the data he needs in order to do something like a cortisone injection. And a cortisone injection is not a procedure that's completely without risk. There is a small risk of infection anytime someone sticks a needle into your back, and is the case with a patient I have right now. The protocol is 3 injections. So in this case, this patient has to go back 3 times and get 3 injections. So just something to keep in mind. Again, I'm not a medical doctor, but if a doctor doesn't watch you walk, doesn't ask if you have an AFO, doesn't ask you, are you walking with your cane most of the time or not, if they have, or they don't want to talk to your physical therapist or have no interest in knowing what your day-to-day activities are, I would say that they might not have all the information necessary to be recommending a cortisone injection. So just something to think about. Again, I'm not a medical doctor, but I just want you to have all the facts so that you're making the best decision for you. In addition to that, a cortisone injection, I've talked about this recently in another video, helps with inflammation and pain. So it does not help improve the quality of your movement. So when that cortisone injection is no longer effective and those underlying movement problems are still there, in most cases, that back pain is going to come back. So my suggestion, and again, I'm biased. I am coming from the lens of a physical therapist who the only thing in our toolkit is conservative interventions or conservative solutions. So again, take what I say with a grain of salt, but I would go back to some of the addressing some of the movement problems and the assistive devices that I mentioned earlier. But again, you're not alone. Back pain is extremely common, and it's extremely more common after a stroke, meaning I've had lots of patients that had no back pain before their stroke and definitely had back pain after their stroke. It's multifactorial. I'm going to be doing a series on pain coming up here, but there are a lot of factors that go into how our brain perceives pain or labels something as painful, which I'm going to be going into in a few videos coming up here. I'm doing a little mini series on that. So just things to keep in mind if you are getting low back pain. Try some of those methods that I mentioned, and hopefully you'll be able to walk longer distances with less fatigue and less back pain. So I hope you guys found this video helpful. If you're new to this channel and you haven't yet subscribed, go ahead and hit that subscribe button, turn on that notification bell so that you will get notified every time I upload new videos. If you haven't checked out our gold membership program yet, there is a link for that in the description below. When you become a member of our gold membership program, you get access to our entire exercise library, which has almost 350 exercises in it at this point, where you can filter through by body part or movement impairment or movement problem that you want to address, and filter down to the exact exercises that address your specific issues. You will also have access to our Discord channel, where we're building a little bit of a community where we can just interact with each other throughout the month. And then you will also have access to our monthly lives, where you can submit questions in advance and meet up with us at the end of each month, where I will answer your questions. So definitely check that out. Link for that is in the description below. If you'd like to support this channel, there are other ways that you can support this channel. Those links are also in the description below. I enjoyed spending time with you all today, and I will see you in the next video. Have a good day.